a time of political sensitivity. We are a public body and we have obligations not to comment on political matters or indeed to make comments that could be used politically. So if I could ask you all to be aware of that, I'd be grateful. So thank you for that. I've received apologies for absence from Shirley Kirkland, Leslie Darbell, Kieran Baker, Damien Allen and Lucy Davis from Health Watch. I don't think I've missed anybody out. Mark, no? Okay, we are quorum. Mark, is that right? Yeah. Thank you. I don't think we've got any declarations of interest. If people want to raise any new ones. Okay, thank you. Minutes of the meeting on the 1st of May. Are they okay for accuracy? Thank you. And the action log is for noting. I don't think there's anything on that matter. I have nothing to report on Chair's matter. Can I now hand over to Gavin for the Chief Executive report? Gavin.
Thanks, Chair. Morning, everyone. So I'm Gavin Boyle, for Chief Executive of NHS South Yorkshire, for those who are watching online. So my report is in the pack, so I'm not going to go through that in detail, but there are one or two points I'd just like to draw out briefly. So firstly, it's just to update everybody, we had a meeting of the Integrated Care Partnership back in May, which is the group that's convened jointly by the 4 local authorities in South Yorkshire and ourselves as the Integrated Care Board, chaired by Oliver Coppard, the Mayor of South Yorkshire. And you'll recall that as part of our strategy, we've got 4 bold ambitions, but one of them is around children and young people and seeking to give children and young people the best start in life possible. So it was good to have a focus, particularly on that part of our strategy at the meeting. And we had an update from the Children and Young People's Alliance, which was focused on some of the innovative work we're involved in nationally with with Professor Sir Michael Marmot's Health Equity unit from UCL and Bernardo's, which is around how do you co-create with young people interventions or approaches that will help improve health, supporting with things like enabling school attendance. So we're at the beginning of that programme of work, but it was good to get an update. We also had an update on a piece of work we're doing jointly with directors of children's services, NHS organisations, the ICB itself across South Yorkshire, our collaboratives and alliances, particularly the Children and Young People Alliance, but also mental health, learning disabilities and autism, which is really around neurodiversity. Some really significant challenges nationally around this issue, and you may have seen coverage of that recently in the media. But I think the view is that by working collectively, we may be able to provide some different approaches that support children and young people who are neurodiverse in a better way. So the first step is to develop a programme of work, which we'll do by the end of July, and bring that back through the Integrated Care Partnership. And I think just sticking on the theme of children and young people, I was delighted last month to attend, I think it was the 3rd conference for children and young people in South Yorkshire last month, which was over 200 people attended, half of whom were children and young people themselves. And I think it was a really refreshing opportunity to be talking about some of the really pressing issues that face the health of young people, with young people contributing a direct experience in the room. So I thought that was an excellent event. I'm really pleased to have been part of that, obviously organised by the Children and Young People's Alliance. Just on perhaps more operational matters in terms of our planning process, obviously this is the first meeting since we submitted our plan, and I give some headlines of that in the report. We met with colleagues from the national team, Amanda Pritchard and her colleagues, back in May, and that plan was accepted, and clearly we're now moving on with delivery, and we'll get a little bit of an update later from Lee in that regard. Sticking with operational matters, industrial action unfortunately is still with us. So yesterday we finished the latest week-long period of industrial action from junior doctors. The ICB has a particular role in coordinating the response across South Yorkshire as a Category 1 responder under the kind of emergency preparedness and resilience arrangements. And I'm pleased to say that particularly time critical services like emergency services, etc., were maintained throughout that period. So it's a difficult thing to manage, but I think as a system, with our provider organisations working together, I think we've managed that period well. I suppose just finishing off on the theme of industrial action, the GPs are currently balancing around action they may take. Clearly, they're self-employed, so that's more likely to be a sort of working to the letter of the contract. So we wait and see what that holds. I have to say we do have extremely good relationships with local primary care providers and the LMCs in South Yorkshire. So it's in everybody's interest to work together to manage that as best as we can. But in terms of primary care, I'm really pleased that we are part of a national piece of work, along with 7 ICBs, integrated care systems across the country, looking at different ways that we might work with primary care to deliver services, but also how we might have a different approach to managing the relationship between providers of primary care services, the GPs and their practices, and the NHS. So I think it's really, really good to be at the vanguard of a piece of work, seeking to address some of the challenges that we know primary care face. We're currently in the process of seeking expressions of interest from primary care networks in South Yorkshire. I'm pleased to say we've had a really strong response. So thanks to some colleagues that are on this call, particularly partner members and non-executive members who have agreed to support a selection process so that we can identify those PCNs who will act as pilots within that piece of work. Just finishing off, one of our priorities, I've mentioned children and young people. One of the first things we did as an integrated care partnership was took a stance that we wanted to become an actively anti-racist health and care system. And I'm really pleased that since our last meeting, the ICB, this organisation, has agreed to adopt the Northwest Health Equality Framework. And indeed, as have all of the NHS provider organisations across South Yorkshire. So I think that's a really positive and practical step. It's linked to very, very clear action, and there's some external scrutiny as well of progress. So I'm really pleased to see that. And also, I talked a bit about primary care, but it's good to see the re-establishment of the primary care race equality network supporting colleagues who work in primary care. And then just finally, just to finish on a couple of positives, we had the National NHS Confederation Conference and Expo a couple of weeks ago. It's good to see South Yorkshire well represented there with the lung health checks programme and the digital health hub, which has been developed in partnership with the universities, the NHS and Google Health UK. But really positive to see that. And we've picked up some awards. So we featured really strongly in the Health Service Journal Digital Awards recently. But also, I think, Wendy, you'll probably mention this in terms of your Barnsley update, but I was delighted to see Barnsley Council winning an award in the Local Government Chronicle for their community blood pressure campaign, the How's the Ticker programme, a really great piece of work and good to get some recognition. But that's it from me, Chair. Happy to take any questions.
Any questions for Gavin? Thank you, Gavin. We have no questions from members of the public, so we'll move straight on to our place reports, and we'll start off with Barnsley. They're in alphabetical order, not those who win awards. That's often what Wendy claimed. Wendy, do you want to go first with Barnsley?
Thank you, Chair. Just a few highlights from Barnsley. Really great that the ICB team are now co-located into Westgate Plaza with the council. We were just checking in last week with the team to see how it was going. There was a universal positive feedback that actually they're really feeling the difference in terms of that just co-location, those coffee conversations that are taking place. It feels as though there's a real rich dynamic now building as a consequence of that. So that's really great. Yes, we do need a bigger trophy cabinet. We were really pleased that How's the Ticker won the Public Health Award at the local Government Chronicle Awards. And we know, I think, that's a great example of wiring improvements into neighbourhoods and going where people are. I think that's what that project has really done, where our stronger communities capacity working with and alongside our public health colleagues and the business community has really seen a difference in that uptake of blood pressure checks, particularly for the target audience, which was men. We also had Learning Disability Week. I know there were lots of activities that took place across South Yorkshire on Learning Disability Week. In Barnsley, we had a focus on creativity, and it was a real pleasure to meet Niall Gweet, who has set up a social enterprise. He's a Special Olympic GB athlete who's turned his hand to creating beautiful drawings of sports stadiums to raise money for Special Olympics GB, and illustrated now 100 stadiums. So please do pop onto Niall's website if you get a chance and support him in his endeavours. Also, as part of Learning Disability Week, it was a real privilege to pop onto the Autism Experience bus, get a real glimpse, however small that glimpse was, into how people with autism experience the world. It was pretty disorientating, I have to say, but it was really insightful, and I was encouraging as many people to do that as I could on that day. We also won a second award as well at the LGC Awards, which was for our supported employment team. And that was quite interesting, actually, because that was in the economic growth category. And you would generally see teams like combined authority teams or town centre regeneration teams winning that sort of category in the LGC Awards. So we intentionally applied for that category to almost like make a point, really. So it was wonderful that the judges recognised the significant work of the supported employment team in supporting businesses to be more inclusive, to support people with additional barriers in getting into work, to actually get into work, stay in work and develop their career. So we were really buzzing to bring that award home for Barnsley, but of course for people with additional needs too. So that was great. A few other things to point out to share with you all. It's probably was time for Barnsley to take stock of the Health and Wellbeing Board. It can be a bit tricky to understand what unique space each of our forums occupy. So we felt it was time to just take a breath and understand what's the unique space that the Health and Wellbeing Board needs to lead. So that was helpful. We're on our way in terms of concluding that. A couple of other things as well to mention. We're really doing some great work around our Sports and Physical Activity Alliance. I think I mentioned previously the number of alliances we have in Barnsley, which are real collaborative leadership bodies really to drive improvement and be creative. And that's all about transforming our communities by moving more. So projects like Game Changer are really making a difference in tackling inactivity, doing some wonderful things around reaching into care homes, and our strengthening relationship with Sports England is really positive. And of course, there's a direct relationship between that and our focus areas in our health and care plan around respiratory and falls. So the more that we can do in that space is really helping the preventative focus in those two areas. And finally, just a couple of other things really. I've mentioned before about our intermediate care and the challenges that we've had with intermediate care in Barnsley. Thanks to the hospital team, we've now been able to transition 26 beds into the hospital and refurb a particular space there, which is a bit of a medium-term solution whilst we try and work on what is the final solution, which for us in Barnsley is a new build. And of course, we're going to have to dig deep in terms of trying to find a creative solution to the capital sourcing of that. Other things to point out really about celebration, we like to celebrate well across Barnsley and to say thank you often. So it was great to join the Hospital Heart Awards and see all the rich effort, I guess, really, and the passion that's across many teams across the hospital. And of course, Swift's awards event as well, Mark. I think that was a great evening too. And we saw a number of people in Barnsley take home some awards, and I know that they were really appreciative of all of that. And I think I'll leave it there. I'm not going to highlight performances also listed on our update. There are some areas of focus, diagnostic rates, for example. There are a few things that we still need to pay attention to, and a particular focus for us, which isn't there on the update really, is about noting that I think we do need to take a bit of a deep dive in Barnsley around LDA inpatient admissions, and we want to just have a look at what more we can do in that space. So I'll leave it there. Thanks, Chair.
Thanks, Wendy. Any questions for Wendy? Wendy, thank you very much. Doncaster, Anthony. Right.
You're on. Thanks, Chair. So from a Doncaster perspective, like at Barnsley, we've just had a review of our health and wellbeing strategy, and doing some good work with partners and indeed the public. Our vision remains adding years to life and life to years, and we're particularly focusing over the next 4 years on areas where we feel that we've been a bit of an outlier in Doncaster. So the 3 areas of focus are improving the experience of ageing, closing the gap in women's and children's health, and creating healthy places to live, grow and play. And we feel as an ICB, we have a particular role in each of those areas. The testimonials throughout the report are designed to sort of show what we're doing in those areas. And there are a couple of ones that I wanted to just point out. I'm really proud of the work that we're doing with the Citizens Advice in Doncaster to improve our digital inclusion offer. We're really starting to see some positive results of this, but describing those results in a different method than what we might have done previously. This might not be necessarily around things like reducing ED attendances, but what it is about is ensuring that our citizens are getting much more support with things like online forms and applications, managing online health and financing, and free digital training and complementary tablets. The qualitative analysis out of this is really, really quite promising, as well actually as the numbers in terms of what citizens are entitled to that they didn't know until this advice was available in places where they're going to be, and what they're receiving as a result. The great news about this offer is that it's rapidly being rolled out to other areas across South Yorkshire. So Barnsley, Rotherham and Sheffield, we're getting some momentum behind that. So I think that's some really, really great work. Some of the qualitative, softer stuff that we do, I really wanted to sort of highlight in this report. The local slipper swap event was something that I thought was fantastic in Edlington, because we have noticed that we are still quite high in terms of slips and falls and admissions to the ED department, and something as simple as inviting our residents along and doing a slipper swap 49 on the day, and you know, trying to just help people help themselves a little bit, really, in terms of preventative care. We had a excellent event in terms of end of life and dying matters, and I think we've got some really great practice in Doncaster in terms of end of life care. In fact, across South Yorkshire, and part of that event was learning from each other in terms of that work. Our Fit Club Doncaster Foundation is a long-term successful initiative, as David knows, has been a big supporter of this in the past, and we continue with our Doncaster Fit Rovers approach. I can vouch for this because I actually did go on this course about 4 years ago. Maybe could do with it again. But the sense of community that this that this brings, as well as improving fitness and energy around our citizens, and Linda's testimonial in the report shouts to that. And then finally, this will get a deeper dive at our place committee, but we have published our latest Doncaster Supporting Families report, which I think sings to some of the things that Gavin had mentioned in his report there. There's still lots to do in this area, but what I am pleased about is the real sense of partnership approach that we're taking across organisations to children and young people in Doncaster. Thank you.
Thanks, Anthony. Any questions for Anthony? Can we move to Rotherham? Chris?
Yeah, morning everyone. When I was doing this report, I noticed it's issue 12, and it's our second anniversary, isn't it? Just gone. So yeah,
It is.
Where have those 2 years gone? Okay, so just a quick Rotherham highlights. So obviously the key thing for all 4 of our places, but especially Rotherham, the Family Hubs and Best Start in Life programme. There's a spotlight here. I've just launched our parent and carer panel. Make sure we get all views heard to make sure our services are meeting everybody's needs. Just going down, Then diabetes swap shops, slipper swap shops. It's a theme. So what this is diabetes is one of our key work streams. It's a huge opportunity in Rotherham. I think we have 7,000 diabetic patients, 16,000 pre-diabetic patients, and it can make a huge difference. So this is particularly focusing on health inequalities and making sure everyone has absolutely up-to-date kit so they can monitor and manage themselves to the best of their ability and working through. So we have diabetes swap shops, which is making sure that the kit works as well as it possibly can. In terms of Ardash, I wanted just to recognise Ardash as being really innovative in the way of engaging members and getting views. I can't wait to see Toby Lewis in his It's a Knockout outfit. But if you could just, I'm trying to advertise this as much as possible. We're really keen to get as many people as involved as possible. So if any board members wish to join any of these events, and please just speak to myself or Anthony. We'd be delighted if you could. The next is the special educational needs and disabilities, or SEND as we call it. We've had a big push and a special mention to Vicky, our designated clinical officer, who's been working really hard to get our, we call them EHCPs, which is Education, Health and Care Plans. And there was a real backlog with them, but now we're seeing the majority of turn around within 6 weeks. So a big push on that, and that's going to make a real difference to families. And especially in this area, there's a real pressure on the family unit where people wait for plans to have coordinated treatment. Next is our Waverley Bill. So if you remember, we had this is the general practice or primary care, the wider primary care estates developments. In Rotherham, we delivered the Broom Lane development in February, and the Waverley Bill, which will service to be a huge housing estate, probably up to 6,000 residents. That it's just on phase 2 of a 4-phase development, but the health centre should be completed November, December time, looking to a January opening, and it will service this new population that we'll have in Waverley. And lastly, just to go through, I know Wendy talked a lot about how well Barnsley Council are performing, but I just wanted to just do a little spotlight on Rotherham Council. As Sharon Kemp, the Chief Executive, who's a member of our ICP, has been awarded the OBE in the latest King's Honours list. Sharon's been through the journey from 2016 when the council was run by commissioners. It was the first council in the country to be run by commissioners, which is obviously not a good thing. It was due to the child sex exploitation scandal. But Sharon's turned it around to get children and young people services rated good, out of special measures and intervention, and recognised as the most improved council in the country in 2022. And the 2023 peer review described them as an impressive organisation which serves its own well. So congratulations to Sharon, well deserved. So that's it, Robert.
Chris, thank you. Any questions for Chris? I think you'd all like me to offer our congratulations to Sharon. We all know her well, a worthy award. Sheffield, Emma.
Good morning, everyone. So from a Sheffield perspective, we've won no awards, so we can't ever compete with Barnsley. So I'm glad we're always last because there's nothing to celebrate. Well, there is actually something to celebrate. We've got, obviously, board members will remember we had £57 million worth of capital for primary care, and we are progressing well on all of those 3 builds. One is in the city centre, one is in the north of Sheffield, and one is in the northeast of Sheffield, some of our most deprived areas. So they're all progressing well, and we're working to sort of green and carbon footprint net zero standards, which is great. But also we are encouraging sort of multi-use space, multi-agency space to try and make those as flexible as possible and wrap services around the patients that we serve. So that's all ongoing. In terms of cancer, obviously you'll be aware that we've got quite a lot of work to do still on particular pathways, particularly around skin and lower GI. And we are looking at a teledermatology service for all skin referrals in Sheffield. We haven't had one, which is quite unusual actually, but we're looking at commissioning one in line with South Yorkshire over the next couple of months. One of the key areas of success in Sheffield, again, has been our Active Together programme, which is a cancer prehab and rehab service, which has helped over 1,000 people prepare for and recover from cancer treatment. It's really, really brilliant, and we're looking again to extend that across the wider population. In terms of discharge and home first, this is one of our key priorities as a place partnership. I'm pleased to say that we've now got a discharge hub in place, and we have seen a reduction in our no criteria to reside. We are aiming for a target at the end of March next year of 13%, and then moving on to even lower than that. And that is significant progress for Sheffield, and creates capacity in the hospital and allows elective performance to improve. There's some other items there, just in terms of our partners. Really happy to announce that Sheffield Teaching Hospitals have been chosen to host a new government-funded National Health Tech Research Centre network, which will support development of technologies and innovations to support care for conditions including cancer, mental health, neurodiversity, dementia, ageing, respiratory disease and cardiovascular conditions. The network, known as the National Institute of Health and Care Research, will identify and influence national health technology priorities to advance technological healthcare. That's quite a big mouthful, across the UK. So I think that's brilliant for Sheffield. We've also implemented a new care and wellbeing service with the local authority, a new model of care that's been rolled out across the city. And in May, a celebration event was held to mark 1 year since the opening of Sheffield Elective Orthopaedic Centre. More than 2,000 patients have been treated there. And again, it's a brilliant initiative in Sheffield. The final remark just for me is, like others, we are reviewing our Health and Wellbeing Board strategy, again, in line with our partnership strategy to make sure that they are aligned. And the healthcare partnership met a week last Monday to sign off our priorities again for this year. We have the 5 original ones plus 2 additional, which are meds optimisation across the city and estates. So that's it for me. Thanks, Chair.
Emma, thank you. Any questions for Emma? Can I just pick up one issue which perhaps we've reported separately to the board, but not fully, and it came out of Wendy's comment. She talked about the move of the officers, and probably not widely known. We've made quite a large-scale move of officers from private sector officers to public sector officers, and to centralised officers in the one place we haven't. And it's probably worth mentioning we've made a saving of over £1 million in doing that. Yeah. And most of our rent now goes to the public sector rather than the private sector. We've done that as an individual item. I'm not sure we've actually sufficiently said to the board how good this is. And I think that's a really important message, that not only we've saved office money, but we've actually put it back into the public sector. And I think that's gone down well with our partners. So I just thought that was worth mentioning. Okay, we move on to agenda item 10, the ICB annual report and annual accounts. That's both Will and Lee. I don't know who's starting this, gentlemen.
Me, Chair.
Lee, thank you.
Very, very pleased to report we've got through the sort of statutory audit process for both the annual report and accounts. Thanks for all colleagues involved in that. The deadlines we have now in the NHS to deliver all that after the sort of month 12 position is quite exercising. So we've worked very well with external audit colleagues. From a financial perspective, we've delivered the £4.9 million deficit that was broadly agreed with NHSE colleagues through the reforecasting process, and that didn't change at all through the statutory accounts process. Just waiting for formal agreement across the whole system around the year-end position as they all run through their statutory accounts process, but nothing to update on or escalate in terms of the statutory accounts position, Chair.
Okay. And anyone else need to come in? Will, do you need to come in on that at all?
Yeah, can I, if that's all right, just a couple of things.
Please, yeah.
Thank you. Just first of all, just to thank colleagues, so to thank Mark, Ruth and Carol, the team for really doing a fantastic job. And I know that we're sort of on our second year, but this is our sort of first full year, isn't it, really, for 23-24 from April to April. So just to recognise the work that goes into this, and it's really important, isn't it, to set out the work of the Integrated Care Board in an open and transparent way. I think the second thing I just wanted to highlight, I recognise that whilst in doing that, this document is not necessarily easily accessible to everybody. So just the commitment and just mindful of the focus and the recommendation from our Audit and Risk Committee around how we make this accessible. So we will quite quickly be ensuring that we've got a more accessible version of this that we can share with the public. So I just wanted just to reference that. And then also just to link to our annual general meeting that, if you remember last year, we held mid-September. I think that was an opportunity for us to bring to life a little bit the work that we've been doing in the Integrated Care Board. If you remember last year, we had quite a focus around children and young people, which obviously is a major priority for both the integrated care system, i.e. the integrated care strategy, and of course the Integrated Care Board as a major partner and player. We were joined, if you remember, by our SRO for our Children and Young People's Alliance, Ruth Brown, last year. So I think the proposition is that we perhaps use a similar approach to bring to life the work of the Integrated Care Board, at least a sort of snapshot at our annual general meeting, which is proposed, Chair, to happen at a similar time towards the end of September, and we need to obviously confirm that date. The only final thing is about the annual general meeting, which, if you remember last year, we did it online, about whether we actually do that face to face this time. But I guess that's for consideration of the board, but it's a proposition we do that at the end of September and have a face to face session with some of our partner members helping us really bring to life the work.
Thanks, well, I'm very happy that we do that face to face, moving it forward. Great. And we were actually delegated to formally sign the accounts, so they've been signed and sent off. Again, we'll carry enforce your work. Thank everybody for their work and effort. I wouldn't underestimate it. So everybody comfortable? We ratify that and adopt the accounts. Thank you all. We now move on to agenda item 11, system planning. A brief update from Lee on 24-25. Lee, if that's okay.
Absolutely fine, Piers. As Gavin already noted, we're proceeding monitoring our agreed plan with NHS England in terms of our overall system deficit of 49.1 million, which is underwritten by NHS England. To achieve that, we need to get the ICB to break even. We're looking at our options at the moment with how we deliver that, reviewing all of our areas of spend, both with NHS England and our system partners. I'll also note in the IPR, we're off plan at month 2, and we're looking at the causal costs for that and how we can potentially course correct for those as we go through the month 3 position, just understanding that position a bit better. So we know what we need to do in terms of delivering a system deficit of 49.1 million, broadly equal to last year's outturn. And we're looking at the moment how all the measures we'll need to take to get the ICB to break even to deliver that. And I think that's all I need to say at this juncture, Chair, and thank you.
Thanks, Lee, and I think we're going to do some more work with the full board on the latter issue as you do that.
Yes.
Thank you. Any questions for Lee? Grand.
Chair, could I just add something
sorry.
to Lee's update? Just mindful that it was financial and operational planning. Just to reference the fact that in agreeing our plan for this year, we did, as part of that, commit to achieving the standards that were set for access and performance delivery for our system across a range of parameters, including access, UEC, cancer, elective diagnostics, and others. I just think it's an important part to play. And one other final thing, if I may, is the planning assumptions that were set for this year were based on no further industrial action. And I'm just mindful that we've just referenced the fact that we've had industrial action in year. So just to reference that at the same time.
Yeah, legitimate to do that. Thank you for reminding us of that, Will. Okay, agenda item 12, emergency planning preparedness. I think that's you again, Will, yes?
Yes, thank you. And just a brief update, if I may. You remember the Integrated Care Board, when it was formed in July 2022, also became a Category 1 responder, which essentially means it's the first responder in major incidents. I updated the board last year on some changes that had been made in relation to how we ensure that we're able to respond both as an organisation, an Integrated Care Board, but also that our local providers are able to respond well during incidents. And we'd had the opportunity to take the learning from other incidents up and down the country, notably the Manchester incident. Therefore, we've adopted a much more robust approach to assuring ourselves against how well we're able to do that. You'll remember that I reminded the board that whilst it looked on the face of it that we kind of dropped in terms of our compliance with those standards, that was in no way linked to the fact that we weren't able to respond positively. It was more about us taking the learning and actually being trying to apply, I guess, a tougher sense of assurance on those standards. So I just want to remind folks of the context. We set ourselves an improving plan, both as an Integrated Care Board and also as a system. to take that learning and implement that into our own processes and approaches to ensure that we continually we're able to improve on how we respond. I just wanted to update the board on the fact that that work is happening, is ongoing. So, and our trusts and ourselves will be meeting next week as part of our local health resilience partnership to take stock of progress for this year. And we'll report on that more formally at our board meeting in September. And we've committed to sharing an update with our audit and risk membership as well before the end of July. So we'll commit to do that. The other thing I just wanted to update the board on is, as an integrated care board, we've got a responsibility for coordinating health in the event of a major incident. That's our major role. And that means we're coordinating the response of health across the whole of South Yorkshire. We've got also the responsibility with us now for ensuring the assurance of our organisation, so our NHS Trust. That's a new thing for our integrated care board for this year. So I just wanted to remind the board that we're taking on that responsibility, and it will be the first time that we'll do that this year. And we'll be working with both NHS England and our trusts on the approach for that. And again, I'll update the board more formally in September on the approach more clearly. And I think the final thing I just wanted to remind us that as part of our changes through our RCA work, we've strengthened our resources and approach internally to how we support this function. So not least, it now sits within our performance and delivery function, which just to remind you was a new function for the ICB. So that gives it greater strength and greater resilience. And we've also recruited to all of the roles that we set out in that structure to our emergency preparedness as well. So in other words, we've started to really sort of pull together our sort of internal sort of organisational response to that. So I just wanted just to update on that progress as well. And
Well, thank you. And that clearly means we'll get a report in September on the outcome of that review, which we look forward to. Thank you for that. Any questions for Will? Thank you. Item 13, integrated performance report. Gavin, are you going to introduce this?
Thanks, Chair. So I suppose the first thing to observe is, and I think I probably say this every time, but I think it's a good thing. This is a continually evolving report, and I think each time I think we receive it, I feel like it's moved forward a notch, and so really appreciate the work that colleagues are doing to make that as useful as possible. Just in terms of headline performance, I'll come to Sarah Perkins last, our Director of Performance and Delivery, just to pick out some of the key operational issues and concerns. But before we do that, I mean, in terms of the major areas of performance, I mean, Lee, in terms of finance, I'm not sure is there much to add other than that, which you've already said?
Not in an inordinate amount. There's slightly more detail in the report of the month 2 performance. I'm in discussions with NHS England about our plan around just delivering the overall required financial performance of the system by the end of the year. And there's a further conversation I'll have with NHS England tomorrow on that. Then I'll bring the product of that conversation back to Finance and Investment Committee and the board. But I don't think I need to add anything beyond that at this stage, Gavin.
Thanks, Lee. And then can I invite maybe David and Kathy? Are there any issues, particularly from a quality and safety perspective, you feel you want to bring to the attention of the board?
So I don't, Gavin, but Kathy, I don't know if you want to say anything.
Yeah, probably just very briefly, just 2 elements. So from a maternity perspective, you'll see from the report that I think what is the challenge for us is the kind of validated maternity data that comes from sort of national sources. There's always quite a lag behind. A lag in relation to that information, so we will have a more up-to-date data set for the next board IPR. The regional team are working on a slightly different data set, which is more real-time, which we will be linking in with. But as the board know, we bring a very detailed update from a local maternity and neonatal assistant perspective to the board twice a year, once a year we focus on the equity plan. The other update, we provide an update on kind of the work we're doing with our organisations around improving maternity safety, and we're starting to do some much more focused work around sort of neonatal services and neonatal data. So hopefully that will start to play through. And the only other element I was going to pick up was around sort of quality overview and quality insight and data from an IPR perspective. As you know, we've had lots of conversations around the fact that actually most of the elements of the IPR pick up areas around quality and safety. So really identifying what is different, that's missing, that we need to bring through to the board is still work in progress, and we're working with Sarah and also the BU and IT teams on that in relation to being able to get a data set, which isn't easy to pull together from an ICB perspective at the moment, but is work in progress. So what we have just provided is an overview of our providers and whether they're currently in any area of quality improvement, escalation and support from us, either with the ICB or with NHS. But all of our organisations that are in a requires improvement element are on a journey of improvement. So they're making really good progress in all of those areas. We've had a review of system quality group and how that works, and that will hopefully improve in how we pull through system learning as we go forward. And we've got a workshop with our Quippy colleagues coming up at the end of July. So I would like to say if any of the board members want to join that, it's a Teams meeting, but we are focusing on the patient safety strategy and some other elements that can't just kind of help colleagues understand the patient safety and quality remit in a little bit more detail. So I'd be happy to share the details of that. If anybody's interested in that, just contact myself or David and we'll share that with you. Nothing else, Gavin.
Thanks, Kathy, really helpful. Christine, are there any issues relating to workforce and people that you want to highlight?
Yeah, thanks, Gavin. Hi everyone, I'm Christine Joan, the Chief People Officer. Just in the report, this is month 12 data for workforce, just to clarify. And it was interesting to note that whilst there was a slight increase in the substantive workforce, it almost exactly matched the number of vacancies. So that's actually a really positive sign. In terms of absence, or whilst the absence rates stayed largely similar, the main reasons remain as mental health and musculoskeletal, which is actually the same as the population in South Yorkshire as well in terms of economic inactivity. Key groups affected continue to be support to clinical workers and nursing. So these are really important factors to note to try and support our health and wellbeing activity. In terms of vacancies, there was a slight reduction, but there are increased controls in vacancy control across our NHS organisations at the moment. And then finally, just on temporary workforce, in month 12, we've seen an increase in temporary workforce. This is a normal pattern that has been observed. So in months 11 and 12, we tend to see an increase, which we identify as being really around annual leave planning. So it's these sorts of patterns that we can start to pick up through our communities of practice, our e-rostering, our technical efficiency around how we plan and use workforce, because obviously these are potentially avoidable spikes in agency usage. So I think it's just helpful to flag that just as an example with the board today. So these are sorts of the things that we'll pick up through our improvement activity. Thanks, Gavin.
Thanks, Christine. And then we kind of move on to operational performance. I must say that in the IPR, I was really pleased to see the development of the kind of population health metrics, but also improved balance in terms of mental health, learning disabilities and autism, and primary care actually featuring more prominently. So good to see that. But Sarah, do you want to give us some headlines in terms of operational performance, key risks, anything you think the board needs to be cited on?
Yeah, thanks, Gavin, and thanks, Chair. So just to note that we are working with all the teams across the ICB to further develop the IPR. So I do expect it to be more rendered again next month in terms of that overall position of where we sit, working alongside Will's team to make sure it links in to our strategy as well. So we can see that golden thread of our 4 purposes and our 3 I's, so that it's absolutely clear to the board in terms of what we're delivering. So that work has started, and as I say, I expect that to see some more improvements in the next board report. In terms of urgent care, then I'll start there. You can see the figures in the report as they stand. We actually saw an uptick in performance in June at 74.5, and we've seen that in some really good areas, i.e. type 1s around Rotherham and around Barnsley, who are absolutely striving in terms of that increased focus on performance and delivery in terms of our most urgent patients. We did, on the back of our urgent care performance at the end of March, receive monies around the incentive schemes. So that was Sheffield Children's Hospital, it was also Barnsley and Doncaster. I think the disappointing thing with that was we received the uplift in our CDL limits, but we didn't actually receive any cash, which for some of our organisations is going to be a struggle to actually make those improvements with those cash. But alongside that, we've also put a bid in for Rotherham for, I think it was £7 million, and we've had verbal, we've had word that bid's been approved, so that is cash back. So that will be a significant change to how we provide urgent care in our ED department in Rotherham. And we're looking at about 600,000, which we favourably think we're going to get for Sheffield Teaching to do some step changes in terms of how we flow through that department. So lots going on in urgent care. Ambulance performance continues to be a challenge, and our ambulance handovers at Northern General are a particular concern for me in terms of the amount of time patients are waiting in ambulances. To support that, again, national monies have been put forward, and we expect to get about £1 million into our ICB, and some of that will be focused around patient flow coordinators in both Sheffield and Doncaster, where we have particular challenges. And that's not just a halo where somebody comes in and coordinates the ambulance. That's looking at somebody at the front door, looking at the pathways across the front door to redirect and support the reduction in ambulance attendances across the system. So lots going on in urgent care. Winter planning has started, and we expect that to flow through our urgent care boards in the next couple of months to make ourselves robust for winter. In terms of elective recovery then, biggest challenge is around delivering 65 weeks for the end of September. As we track at the moment, we've got about 7,000 patients left to treat. So if you just divide that by the number of weeks we've got left, in theory we should be fine. But if you do that at specialty level, we've got specific challenges around neurology in Sheffield and ENT in Doncaster. We had our elective recovery group last week. Doncaster gives some plans in terms of how they're looking, and they don't think they need mutual aid for the system, so they think they've got enough with the additional capacity coming online to deal with that. Sheffield are more challenged around neurology. They're looking at an insourcing model, but if I had one thing flashing, we've got some work to do in terms of Sheffield and neurology and how we make that a sustainable services. Alongside and underpinning that is obviously our diagnostics. And we've got a couple of challenges in there, one of which specifically is around audiology, where we've got issues around paediatrics and adult services. And I think we've also got some quality issues in there, though I think we need some clarity first around how big that risk is around the quality issues and our audiology services. So David and I have a conversation later on today about do we need to consider looking at indicators around audiology. Other bits of diagnostics are in children's services, where we've got, because children can't just go in an MRI scanner or a CT scanner, they need to be anaesthetised, so that takes a lot more resource. So we've got some specific backlogs that we're still struggling to get through in our children's hospital around our diagnostics. Emma's already mentioned the cancer and the tier 1 work that we've got going on in Sheffield. We are a significant outlier in our faster diagnosis standards, and you can see the numbers in there, but we hit about 50%, I think it was in April. We have done some work in the immediacy around putting some additional capacity in there, but that is short-term fixed stuff, and we've still got to get some underlying plans to make our cancer services sustainable, which is the work the teams are doing alongside support of again £1 million from regional colleagues to help us get back on track. In terms of mental health, you can see it there in terms of the growth, out of area placements, specific challenge for us, especially for our DASH colleagues, where we seem to have bigger numbers in that. The worry I've got about mental health is, one, the challenge in delivering it, but two, we're going to have a data problem because they're upgrading the national systems. So data for mental health is going to be a challenge in the next 6 months. So we need to keep a close eye and a close focus and decide how we're going to monitor that across the system. And there is work ongoing for that. And in terms of primary care, we've already mentioned it, but we continue to see growth in attendance across the primary care against last year, and that continues into this year. And the industrial action for GPs is going to be, it's going to be a real challenge in a way that the junior doctors wanted. It takes it to another level. Junior doctors, it was 5 days. We planned for it. We knew the consequences. The range of actions that primary care are going to take are multiple, varied, and Auntie and I had a conversation. It might be different on a different day for different practices. We've got some scenario planning across not just the ICB, but with the other 3 ICBs and NHSD in the next couple of weeks to try and understand what mitigations we can put in place. But I think it's going to be really difficult to mitigate because the actions are going to be individual based, practice based, and as I say, they might not be on the same and every day of the week. And the worry with the primary care actions is once they stop doing stuff, will they ever go back to doing it? So that is some work we need to do around how we plan for that. So I think that's the big challenges from the report, but I'm happy to take any questions.
Thanks, Sarah. That was really, really helpful and comprehensive.
We've got a question from Richard Parker. Richard?
Yeah, thank you, Piers. Thank you for the report. I echo Gavin's initial sentiments about the developing report. I think it is becoming really useful, and every meeting it gets better. My comment really, though, is in respect of the general practice potential industrial action. I do hope that following the election tomorrow, whichever government is in power, that we can settle off the industrial action. The GP action, I think, is of a different scale. So not only will it be difficult actually during any industrial action, the potential in terms of what may be, changed during industrial action, I think, has longer term implications for the acute sector. If we don't see the sorts of services and work that general practice do in terms of referral management or other during any industrial action, then the scale of the problem in terms of waiting lists, diagnostics and others could be significantly increased, particularly, as Sarah said, if the action continues in that once the things have changed, they don't go back to now, then I think we've got real implications potentially moving forward. So it's just worth noting that this is something really, really urgently in need of resolution at a national level.
I agree, Richard. Thank you. Ben, you've raised your hand.
Thanks, Piers. Yeah, I think really good to see the IPR report developing as it is. And I think one of the things really good for me to see is that we're starting to get those health inequalities measures in there. And I guess it brings something for me around the board, how we look at those and how we make sure we're delivering that duty around having regard for inequalities. So the two areas that come up on the report as it is, I think there's more in the dashboard if we can get access to that rather than just having a PDF. But the early cancer diagnosis, difference between 47% in our most deprived and 56% in our least deprived of getting early diagnosis, and hypertension management 68% to 74%, and some of those gaps, if we really want to achieve those healthy life expectancy targets and narrow our gap to the national, it's how we focus on changing some of those gaps locally. And I think the way the data is now being presented gives us new questions that we can start to ask and look for assurance on.
Yeah, I think that's right, Ben. I mean, I think I said to the board a while ago, if we don't measure it, we won't do it. And starting to measure it's really important, and it starts exposing those things, Ben. I think that's really good for us. So yes, thank you. I agree with that, and thanks to the team who put this together. It does feel better, does feel more rounded, does feel more like our responsibility. Okay, any other points people want to raise? Gavin, thank you for that. Corporate assurance report, Mark.
Yeah, thank you, Chair. So first of all, apologies to colleagues and to you, Chair, for the size of the pack. Given that it was a light agenda, we took the advantage of bringing forward a number of items that need to just be ratified. So there are 4 themes, although I'll take the report as read. There are 4 themes I just want to tease out very quickly. The first is the corporate assurance report itself highlights the key governance activities that have taken place in the period since the last report. That includes and has already been referred to in Lee's item at item 10 with Will around the internal audit and external audit reporting. The corporate seal has been used once, and that's relating to the licence at Street, but it's important to bring that to the board's attention. The number of freedom of information requests, complaints, and subject access requests that the organisation has received and has responded to within timescales is set out in the report, as is the key business that's been undertaken in the assurance committees of this board. Second thing I just want to highlight, and this is just for completeness, is that the assurance committee terms of reference have been subject to internal audit and have been through review and have then been reviewed by each of the committees and are now presented to the board for ratification. So that's the second item. And the third item is on a similar vein. There are 3 corporate policies for ratification, one relating to corporate incident management, one relating to network security policies, and one relating to registration assurance policy. So they're presented to the board for ratification. And the final piece that I just want to highlight is the board assurance framework, and the corporate risk register is included in Appendix E to the report, which sets out and highlights our key corporate risks and the associated mitigating actions. And again, they're presented to the board for information review and for agreement.
Thank you, Mark. So there's a number of things that we're ratifying there. People comfortable that we ratify those? Both changes to the terms of reference of the assurance committees and those 3 policies that we mentioned. People comfortable with that? Mark, thank you. I know a lot of work went on in that. We then have a series of items just for information. I'll just go through them. People can raise any questions if they want. Minutes of the ICB public meetings. ICB systems leaders executive meetings, which we now bring to the board, which we didn't previously. Thank you for that, Gavin. The minutes of the place meetings, 4 place meetings, and our own assurance committees. Nothing people want to raise on those? Thank you for that. We do not have a private meeting. There's no private agenda item. So at 10:27, that is the end of the meeting. Thank you very much, everybody. Have a good day. See you now.
Thanks, everybody.
Thank you, everyone. Bye.